Are you managing elevated creatinine levels and wondering if your snack choices could be affecting your kidney health? Many people with kidney disease assume all nuts are equally healthy, but research reveals some surprising differences. While following your healthcare team's guidance remains essential, understanding which nuts may burden your kidneys versus those that research suggests could be beneficial makes a meaningful difference in your daily choices. Some nuts contain mineral levels that research indicates may compromise kidney function, while others show promise in supporting kidney health when consumed appropriately. Today, we're exploring what current research tells us about 3 nuts that studies suggest kidney patients might want to limit, and 3 alternatives that research indicates could be safer options. We'll examine the specific compounds that make certain nuts problematic for kidney function, while revealing science-backed alternatives that could actually support your kidney health journey. From hidden phosphorus bombs to selenium toxicity risks, these findings might surprise you and change how you think about nuts forever. When managing kidney health, mineral content varies dramatically between nuts, creating challenges for people with chronic kidney disease. Traditional nutritional advice treats all nuts as universally healthy, but kidney function changes everything. The primary concerns are phosphorus, potassium, and oxalates. Studies indicate these minerals accumulate differently depending on kidney function, and some nuts contain concentrations that can overwhelm compromised filtration systems. Clinical data suggests certain nuts may influence creatinine levels through mineral overload. Phosphorus presents the most immediate concern. Research documents that damaged kidneys struggle to filter excess phosphorus, leading to dangerous blood accumulation. This triggers calcium removal from bones and accelerates kidney damage. Potassium creates similar challenges with elevated levels causing dangerous heart rhythm changes. Oxalates form crystals in kidneys, potentially causing acute injury. Case studies document severe nephropathy from high oxalate nut overconsumption. However, research reveals encouraging findings. The National Health and Nutrition Examination Survey study of over 6,000 adults found certain nut consumption patterns correlated with significantly lower chronic kidney disease prevalence. Some nuts show kidney protective properties rather than harmful effects. Individual tolerance varies dramatically based on kidney function stage. What remains consistent is that informed choices based on understanding mineral profiles can meaningfully impact kidney health outcomes. Now let's examine the 3 nuts that research suggests kidney patients should approach with extreme caution or avoid entirely. Number 1. Sunflower seeds, the phosphorus bomb. Research indicates sunflower seeds present serious challenges for kidney management, earning them the title of phosphorus bombs. Studies show sunflower seeds contain 1,155 milligrams of phosphorus per 100 grams, nearly double the daily recommended limit and potentially dangerous for compromised kidney function. This extreme concentration creates mineral overload. Clinical data suggests even moderate 30 to 50 gram portions can push phosphorus into dangerous territory for kidney patients. When kidneys can't filter excess phosphorus, it accumulates in blood, triggering calcium removal from bones and accelerating kidney damage. Research documents additional cadmium concerns. Consumer lab testing found cadmium levels of 3 to 19.5 micrograms per 30 gram serving across 9 products, with 6 exceeding safety warnings. Compromised kidneys show reduced heavy metal clearance, creating toxicity risks. The 850 milligrams potassium per 100 grams creates additional problems. Studies show this amount is too high for people with advanced kidney disease because too much potassium in the blood can cause dangerous heart problems. When you combine the high potassium with the extreme phosphorus content, sunflower seeds become extremely risky for kidney patients. What makes them deceptive is their health food reputation. Many consume them thinking they're healthy, unaware of kidney-specific risks. Research shows kidney disease patients who regularly ate sunflower seeds had significantly higher phosphorus levels and increased progression markers. The 19 to 21 grams protein per 100 grams may exceed recommendations for patients requiring protein restriction. While low sodium 6 to 9 milligrams is positive, it cannot overcome the mineral concerns. Studies consistently show sunflower seeds are unsuitable for patients on renal diet plans and those with advanced kidney disease. The combination of extreme phosphorus, cadmium contamination, and high potassium creates a perfect storm that research indicates can accelerate kidney damage rather than provide nutritional benefits. Number 2, Brazil nuts, the selenium toxicity trap. Moving to another nut where research reveals dangerous selenium concentrations, Brazil nuts present one of nutrition's most deceptive risks. Studies show these nuts contain 1,917 micrograms of selenium per 100 grams, representing 3,485% of daily requirements and creating immediate toxicity concerns. Research indicates selenium toxicity potential at just 2 nuts daily. The recommended upper limit is 400 micrograms daily, which a single large Brazil nut can exceed. Clinical reports document adverse effects including hair loss, nail brittleness, gastrointestinal distress, and severe kidney damage from selenium poisoning. The narrow, safe consumption window makes Brazil nuts particularly challenging. While controlled studies in hemodialysis patients showed benefits from exactly 1 Brazil nut daily, the therapeutic window is extremely narrow. Research suggests 4 or more nuts can cause selenium toxicity, while the high phosphorus content of 725 milligrams per 100 grams creates additional mineral management challenges. Case studies document concerning outcomes from overconsumption. One patient consumed 10 to 15 Brazil nuts daily for months, developing selenium toxicity with kidney function deterioration. Another study showed that while 75 milligrams of Brazil nut powder provided kidney protection in animal models, 150 milligram doses actually worsened kidney function. The potassium content of 659 milligrams per 100 grams requires monitoring, though it's more manageable than selenium concerns. Individual nuts vary dramatically in selenium concentration depending on soil conditions. Studies suggest that while Brazil nuts show potential therapeutic benefits under strict medical supervision, risks generally outweigh benefits for most high creatinine patients. The combination of selenium toxicity potential, high phosphorus content, and unpredictable nutrient concentrations makes them unsuitable for casual consumption. Number 3, peanuts. The oxalate nephropathy risk. Research on this common legume reveals important findings that challenge peanuts' reputation as a healthy protein source. Case studies document oxalate nephropathy occurrences from peanut overconsumption, with severe kidney damage from what many considered moderate intake. The critical finding centers on oxalate content. Studies show peanuts contain 148 milligrams of oxalates per 100 grams, with research suggesting a concerning threshold around 130 grams of daily consumption. One documented case involved a 44-year-old man who consumed large amounts of peanuts daily as snacks, developing acute oxalate nephropathy requiring emergency intervention. Another case study documented a patient who regularly ate peanut butter sandwiches multiple times daily along with other peanut-containing foods, eventually developing serious kidney problems over time. Research indicates hidden sources significantly increase total oxalate intake. Peanut butter, widely consumed in large quantities, concentrates oxalates while making overconsumption easy. Studies show people often underestimate their peanut product consumption, with peanut butter sandwiches, cookies, and sauces creating cumulative oxalate loads exceeding safe thresholds. The phosphorus content of 376 milligrams per 100 grams, while lower than sunflower seeds, still requires monitoring for kidney patients. Combined with potassium levels of 705 milligrams per 100 grams, peanuts create mineral management challenges that compound oxalate concerns. Clinical data shows overconsumption risks extend beyond individual cases. Research documents that regular high-dose peanut consumption correlates with increased kidney stone formation and, in susceptible individuals, progressive kidney damage. The affordability and widespread availability make overconsumption particularly likely. What makes peanuts especially concerning is their ubiquity in processed foods. Studies indicate people consume peanuts through multiple sources daily without realizing cumulative intake, making it easy to exceed safe consumption levels for kidney stones prevention. Now that we've cleared the dangerous nuts from your pantry, let's explore the kidney-friendly alternatives that research suggests can actually support your health. These three nuts offer hope. They're not only safer for your kidneys, but studies indicate they may provide protective benefits when consumed appropriately. Number 1. Pecans, the kidney champion. Studies indicate this underrated nut may offer significant kidney health benefits, earning its place as our top recommendation. The landmark National Health and Nutrition Examination Survey, research involving 6,072 adults, demonstrated that consuming nuts 1 to 6 times per week may reduce chronic kidney disease risk by 47 to 48%. Among individuals with existing kidney disease, this consumption pattern decreased all-cause mortality by 37% over 11 years. Clinical trials reveal impressive metabolic benefits. A controlled study of 26 adults consuming 68 grams of pecans daily for 4 weeks showed significantly improved insulin sensitivity and beta cell function, alongside a 39% reduction in composite cardiometabolic risk scores. An 8-week study with 56 people showed that eating pecans reduced bad cholesterol by 30 to 33%, proving they provide strong antioxidant benefits. Nutritional analysis reveals kidney-favorable characteristics. Pecans contain just 277 milligrams of phosphorus per 100 grams, among the lowest for tree nuts. Potassium levels of 410 milligrams are safe and easy to manage. The protein content of 9 grams provides good nutrition without overloading the kidneys, while having 0 sodium helps with fluid balance. Pecans contain natural compounds that fight inflammation and protect cells. Research suggests these protective substances may help shield kidney cells from damage. Early-stage patients can eat 1 ounce up to 6 times per week with regular checkups. Advanced patients should eat smaller portions and monitor their lab results closely. Pecans are low in oxalates, making them safer than many other nuts. Number 2. Hazelnuts, the balanced choice. Research suggests this option offers promising characteristics for kidney health management. Hazelnuts demonstrate kidney protective effects through multiple mechanisms, with the National Health and Nutrition Examination Survey, a population study linking regular consumption to lower chronic kidney disease prevalence. A clinical trial with 24 participants showed significant improvements in antioxidant activity and cellular protection after 6 weeks of consuming 40 grams daily. Nutritional profile shows balanced characteristics requiring monitoring but not prohibition. Hazelnuts contain 290 milligrams of phosphorus and 680 milligrams of potassium per 100 grams, both at moderate, manageable levels. They provide 15 grams of protein and have no sodium, which helps with fluid balance. They're also rich in vitamin E for antioxidant protection. Prices vary by region, typically $6 to $9 per kilogram for raw hazelnuts. Turkey produces most of the world's supply, which affects pricing. Early-stage kidney patients can eat 1/4 cup servings 1 to 6 times weekly. Advanced patients need smaller portions and should consult their doctor. People prone to kidney stones should be cautious but can still enjoy them with proper hydration. Hazelnuts provide antioxidant benefits that may protect kidney cells from damage. Their balanced mineral content makes them suitable for chronic kidney disease patients when eaten in proper portions with regular monitoring. Our final recommendation represents the premium option in kidney-friendly nuts, offering exceptional benefits but requiring careful consideration of cost and accessibility factors. Number 3. Pine nuts, the premium protector. Research indicates this option may provide kidney-supportive properties, though cost considerations limit practical applications. The National Health and Nutrition Examination Survey analysis demonstrated 33% lower chronic kidney disease prevalence among regular consumers, with 37% reduction in all-cause mortality for existing kidney disease patients. Studies show pine nuts help with hunger control and blood sugar regulation. Research found that eating small amounts daily improved hormone levels that make you feel full and help control glucose. However, pine nuts are high in phosphorus at 575 milligrams per 100 grams, which requires careful monitoring for kidney patients. They contain 597 milligrams of potassium, moderate level, 13 to 15 grams of protein, and only 2 milligrams of sodium. The magnesium content of 251 milligrams provides heart benefits. Pine nuts are significantly more expensive than other options, costing 3 to 4 times more than common alternatives. This makes them a premium choice that many patients may reserve for special occasions rather than regular consumption. Safety profile includes unique considerations. The high phosphorus content contraindicates use in advanced kidney disease without careful monitoring. Pine mouth syndrome affects a small percentage of consumers, causing metallic taste lasting 2 to 4 weeks without health consequences. Studies suggest pine nuts offer kidney protective benefits for kidney function maintenance, though the cost factor means they work best as an occasional treat rather than a daily staple for most kidney patients. Now that you know which nuts to choose and which to avoid, let's discuss how to safely incorporate these kidney-friendly options into your daily routine. Studies suggest portion guidelines vary by kidney function stage. Early-stage chronic kidney disease patients can typically consume 1-ounce servings of pecans or hazelnuts 1 to 6 times weekly, based on National Health and Nutrition Examination Survey population data. Advanced kidney disease requires reducing portions to half-ounce servings with close phosphorus and potassium monitoring. Research indicates important label reading strategies. Look for unsalted, raw varieties without added phosphorus preservatives. Avoid flavored nuts containing potassium chloride or sodium phosphate additives that studies show can rapidly elevate mineral levels. Clinical data supports meal planning approaches. Consume kidney-friendly nuts earlier in the day when paired with lower potassium foods like cucumbers or celery. This helps balance daily mineral intake and prevents evening spikes that research shows can strain kidney function overnight. Preparation methods significantly impact mineral absorption and safety for kidney patients. Raw pecans and hazelnuts retain their beneficial compounds best, while light roasting at low temperatures preserves nutrients without creating harmful compounds. Avoid overcooking pine nuts, which studies show can destroy protective antioxidants and create oxidized fats that may burden kidney function. Light toasting for 2 to 3 minutes maximum preserves their kidney supportive properties. Soaking hazelnuts for 4 to 6 hours before consumption may help reduce phytic acid content, potentially improving mineral absorption according to preliminary research. Pat dry thoroughly before eating or light roasting. Store all kidney-friendly nuts in airtight containers in cool, dark places. Proper storage prevents rancidity that can create inflammatory compounds harmful to kidney health. Never consume nuts that taste bitter or rancid, as studies indicate oxidized fats can worsen kidney inflammation. Fresh nuts should have mild, pleasant flavors without any off-tastes that suggest deterioration. Research provides valuable insights into kidney-friendly nut choices, but individual responses vary significantly. The studies we've discussed, from the National Health and Nutrition Examination Survey population data showing 47% risk reduction to clinical trials demonstrating metabolic benefits, offer encouraging guidance for informed decisions. Remember that these findings complement, never replace your healthcare provider's recommendations. Your nephrologist and renal dietitian understand your specific kidney function stage, lab values, and individual risk factors that influence safe food choices. This information is for educational purposes only and doesn't replace medical advice. Always consult your healthcare provider before making dietary changes with kidney disease. If this video helped clarify kidney-friendly nut choices, please give it a thumbs up and share it with others managing kidney health. Subscribe for more evidence-based kidney nutrition content and hit the notification bell so you never miss updates that could support your kidney health journey.